So thank you all once again for joining us for today's free webinar hosted by Prevention Plus Wellness LLC, located here in beautiful and sunny St. Augustine, Florida. If you haven't been down here, check it out. Come on down. A great place to visit, to vacation. I'm happy to show you around. All you have to do is contact me and I'll walk you through the area, give you a quick overview. It's a great place to visit and to live at St. Augustine, Florida. My name is Dr. Charlie Warch, and I'm CEO and founder at Prevention Plus Wellness. Thank you again for joining us for today's first ever webinar on, as you can see the title, Evidence-Based Prevention Program Registries, the good, the bad, and the ugly. Now, normally, when you read about evidence-based program registries, you'll hear about the good. But excuse me, you'll hear about the good, but rarely will you hear about the bad, and certainly you will not hear about the ugly. And so I wanted to give you a full picture of evidence-based programs and practices registries today. For those of you that are in the substance use prevention, health promotion fields, I think it's going to be very, very exciting, interesting, hopefully helpful for those of you. So just again, one more time, I am recording today's session, and everyone who's registered will receive a link probably later today. So you don't need to reach out to me. I'll reach out to you, and you will get a link with the recording, the slides, and a CEU certificate. Okay, awesome. Again, welcome to the session. If you want to check this chat space, you'll see everyone signed in that wanted to sign in and introduce themselves. Thank you for doing that. And today's objectives. Let's jump right into it. There's 3 of them. You'll be able to list essential facts about evidence-based program registries, or EBPR, or EBPR and EBPRs for substance use prevention and health specialists. So there's a lot of evidence-based registries for programs and practices in a lot of different areas, but we're going to focus on those most relevant for you in the substance use prevention and health fields. Number 2, you're going to be able to describe the good, the bad, and the ugly. In other words, the benefits, the limitations, and the problems associated with evidence-based program registries. And lastly, you're going to be able to compare and contrast selected evidence-based program registries. So we can't do them all. There's just many of them, but I will give you plenty of resources so you'll be able to spend a lot of time exploring them. I'm sure many of you have various experiences with this already, and so you'll be able to share those with your colleagues here online today. Particularly, I suggest in the Q&A space, if you have a question, you have a comment, you want to share something, you want to share your experience, that's the place to do it, and we'll look at that at the end of today's sharing of slides. Also, I'm going to give you 3 opportunities to participate in this webinar as well. So you'll be able to participate. So if you can, please do. We want to hear from you. So again, that 3rd objective, to compare and contrast EBPRs and how they can be used to identify evidence-based prevention programs, which promote healthy lifestyles among you. So we will focus on those that Prevention Plus Wellness programs are listed on, because we're most familiar with those. So we'll share those with you. All right, before we start talking about essential facts about evidence-based prevention programs, let me go ahead and launch a brief 3-question poll. A brief 3-question poll so that everyone can participate. And if I could find that poll, there we go. Let's see here. There's the poll. And I'm launching it right now. So it's coming to you. 3 questions, I think yes, no, each of them. So it'll just take a moment. So please do participate so we can get your thinking on this. Usually a chance to participate. Of course, if you're on just listening, you won't be able to do that, but you will be able to hear what others have said. So you may need to scroll down to see the second or third item, but there are 3 items, 3 questions. So I'll just give you a moment or two to answer those. The more people that participate, the better. That way we get a better view of who's on today's webinar, and we may even be able to tailor a little bit of our discussion to your particular needs and interests. 3 questions, yes, no each, I believe. And so why don't you answer those, and then I'll share those results with everyone. Again, thank you all for joining us. I really appreciate it. PreventionPlusWellness.com is our website if you want to check out more about what we offer in the prevention and wellness field for youth, young adults, and adults. So let's see, 3 questions. We've got 76% participated. Wow, we jumped right into it. That is amazing. And let me just give you another 30 seconds because we already are up to 77%. Let's see if we can get up to 80%. It's always exciting to have 8 out of 10 people participate. Let's see if we can reach that. It's a goal. We're up to 79. We're almost there. Boom! We did it. We reached 80%. So I'm going to end the participation. 81%. Wow. Thank you so much. You guys are amazing. And here come the results. I sent them to you. They may take a moment, but as they come to you, I'm going to read them. The results. Question number 1. Have you ever used an evidence-based program registry? And the majority of you, 54%, said yes. That's followed by 29% no and 70% not sure. And really, all of you are essential. So those of you who said yes, fantastic. We'll give you an opportunity to share what you've experienced. For those who said no, you're going to learn something. For those of you not sure, we'll help clarify for you what we're talking about evidence-based program registries. Number 2. Second question, did you find evidence-based program registries helpful? Did you find them helpful? And just under half said yes. So half said yes, about 49%. But we had 7% said no. And of course, you got 44% that they don't know or they've never used one. So you can see there's some issues, perhaps some limitations to these existing evidence-based registries. We'll discuss that today. Some pros and some cons, definitely. Last question, do you rely on evidence-based program registries to identify programs to implement? And the questions, and most of you said yes, 42% said yes. Another almost quarter, 24% said no. And over a third, 35% said not sure. Fantastic. So we have some people definitely implementing them, others not, some not sure. So we'll address all of those things today with you. So back to the question at hand, essential facts about evidence-based program registries, practices registries. We'll start there with some information. We'll talk about identify what we're talking about. So these evidence-based programs or practices registries, EBPRs, typically they're online databases. They don't always have to be, but we will focus on those in particular. And the key thing is that they compile and they organize information about programs proven effective through rigorous research. Now, scientists, researchers won't typically use the word proven effective because science is, just to give you a little inside scoop here, science isn't a matter of certainty, it's a matter of percentages or chances or likelihoods. So it's the evidence. How much evidence is supporting this versus not supporting this? So proven effective is not perhaps the best term, although it's used quite a bit. But found effective or evidence supporting effectiveness is actually a more realistic understanding of it. So, I mean, it's the whole thing about science. Science is critical. Here we live, by the way, in a post-science and postmodern period where there's real questions about science, sort of, pros and cons. There's some debating about it. If you want to use science, and we certainly here at Prevention Plus Wellness are really data-based, science-based, we believe that science and information is critical to understanding how you can be more effective and document your effectiveness as prevention and health specialists. So just keep that in mind. We're focused on promoting evidence. We believe that's important because it is possible for you to use programs that are A, not effective, or even worse, B, counterproductive or negative, have negative effects. So remember, if anything can be effective, whether that's prevention or treatment or any kind of intervention, it has potential to be effective. It also is likely has the potential to be harmful. Keep that in mind. So, and then secondly, these evidence-based program registries identify and will help you identify, and in some cases help you implement interventions supported by scientific evidence. So what are they? EBPRs, they're carefully curated collections of interventions. So they're not just a list of interventions, but there's some process by which one or more individuals or groups of individuals have identified evidence supporting the effectiveness or the research indicating effectiveness toward a particular program or practice. So the focus is on programs and practices aimed at prevention, preventing health problems. That's what you usually see: preventing substance use, preventing mental health problems, treating mental health problems or substance use problems, etc. And another thing about evidence-based program registries is that they should be in a user-friendly format. Now, this differs per registry. Some of you may find some of these registries more user-friendly than others, at least I have. And so the goal is for them to be easy to use, but I think you'll find that some of these registries are not all that easy to use. So there's a difference with regard to ease of use. So what do they or might they include, these EBPRs? Well, before we answer that, let's just identify some other terms for evidence-based programs or registries. You'll sometimes hear quote unquote evidence-based clearinghouses, evidence-based program databases, and evidence-based resource centers. Those are all different terms for pretty much the same thing. They compile existing research about individual programs, program models, or clinical practices that, again, supported by research, not necessarily proven, but evidence supporting them, which is better than no evidence supporting them or evidence indicating potential negative effects with them. Lastly, number 3, what's included is sometimes program descriptions, formal ratings, or some kind of an assessment of the program effectiveness, the quality of the research that's supporting or not supporting program outcomes. And on occasion, you'll find in these databases implementation assistance. Very important, because if you find that a program is effective and you don't have implementation directions, it's really hard to go from the research to practice. All right, let's talk now. That was some basic understanding, but now let's get into the good, the bad, and the ugly. The good, I'm sure you've heard of, or many of you have heard about the good, the potential for evidence-based program registries. They're designed to empower professionals like yourselves and communities to make informed decisions based on solid evidence. How solid depends on the registry, but that's the goal. That's the anticipated outcomes of them being evidence-based program registries. They can contribute to better health outcomes and reduce rates of negative consequences. So that's the underlying assumption. If these evidence-based program registries are used by professionals like yourself, the underlying assumption is that's going to drive more awareness of, identification of, hopefully use of, and high fidelity implementation of these programs, which will improve health outcomes and reduce negative health occurrences. EBPRs should or have the potential to save time and resources because they're a centralized location for effective programs and practices. So rather than you, for example, doing a Google or whatever type of a search, looking for programs, if you go to a database, a lot of that work has been done for you. And if the database is easy to use, it can save you some time. So there's a lot of ifs, by the way, with these goods. And they can help ensure that programs are implemented with fidelity if that information is included in that database. So a lot of potential and a lot of ifs. There's some more goods. Good number two, there was good one. This includes, so good number two, these databases can increase the systematic use. That's the goal, systematic use of empirical evidence to guide your decision making in which programs or practices to use, help you identify those that are most effective, and lastly, help you select and implement programs and practices or policies that research has shown to work or be most effective. So that's the good. Let's talk about, before we go talk about the bad and the ugly, let's pause at this point and let you participate. Other than those good benefits, are there other benefits that you've seen or are a reason for you to use evidence-based program registries? So let me pause and let you participate. So go to the chat space, and if you have some other reasons or benefits that you see that have been a reason for you using or potentially using evidence-based program registries, let's hear from you now. So let's check the chat space and see if anybody is answering to that, if they're sharing anything. You know, we gave you some goods, I gave you some benefits of evidence-based program registries. Are there some others that we missed that I didn't mention that are a reason for you to use or potentially use evidence-based program registries? So let's take a look at it. I see Elizabeth says provides opportunities to compare programs. Great point, Elizabeth. If you were to do a Google search, you're not going to see those comparisons. If you go onto an evidence-based registry, it's much easier because that data is centralized. It's there in one place. And you could actually compare program A and B or practice A and B, and that gives you some insight. So that's a great suggestion. Any other? Karen said, they specify ages and target populations. That's a great comment as well. So they give you a little bit information as to where they may be used, what population. Jessica says, see what programs meet deliverables. Not sure what those deliverables are, but that's a good point, Jessica. If you can clarify that, I'd love to hear more about that. Janice says, I use them to find evidence references for specific strategies, not whole programs. Okay? Not whole programs that may not meet needs, and yet they want huge monetary compensation. So it sounds to me like Ginny is actually identifying a potential negative aspect of them. So you may, or maybe not. Maybe you're finding effective programs, but then you can see if they're too expensive. And so cost is an issue. That's a good point. Uh, Janice says, our New York State's evidence-based program registry lists programs that are more potentially funded by state funding sources. So that's really important. So in other words, to identify those programs that will be supported financially by your state or communities. Tammy says it gives you more detail related to age. Very good. Michelle says the detail that's related to each age group. Margaret says manage expectations of partners in terms of expected behavioral change. All of those excellent examples. I'm going to pause at this point. Thank you so much for all of you participating to help us understand some additional goods or benefits of evidence-based program registries. Now let's take a look at the bads and the uglies. So what are some bads or potential downsides or limitations with evidence-based program registries? A clear meaning of evidence-based, quote unquote, practice or program is lacking and differs. The standards differ for what works and what do we mean by what works across these evidence-based registries. So if you look across registries, if you look within the registry, it's not a problem, but if you look across registries, you'll see these differences. And I guess it is a problem if you just stay within the registry because you're only going to get one perspective on the definition of evidence-based and what works. Secondly, a lot of times the program success is based on contextual factors. You mentioned earlier, some of you mentioned age specificity, but setting, location, who's implementing, what the training level is. There's so many variables involved. So even if an evidence-based program is identified as evidence-based and interventions identified as having some scientific support for its effectiveness, there's these contextual factors that come to play that may or may not be addressed, and they differ across time. So you can have the strongest research supporting, let's say, a substance use prevention program, but that was a research program that's different than real life practice. And it's unlikely that it was done across the whole country, representing all settings, all age populations, all scenarios. There are just too many variables involved. So the point is that, again, the evidence, there's limitations to the evidence, not just scientifically, but contextually. And then lastly, many interventions show mixed results. The reality is that, research doesn't necessarily show complete, one-sided results. There's good results, there's not so good results, there's positive results on one behavioral outcome and not in another. And the results may be overall a little bit misleading. And so and that's just part of the reality of science. It's not necessarily clear cut. Again, it needs some interpretation by scientists and practitioners like yourself. And that's why it's important for you to become very familiarized with evidence-based registries and research. Now, let's talk about some ugly. You will rarely hear about the uglies because, generally speaking, our professions will, whether the prevention or public health or substance abuse or whatever the case, of mental health, they want to promote program effectiveness, which is a good thing. And so they'll not necessarily talk, and sometimes they'll talk about the bads, not very often, but rarely will they talk about the ugly. In other words, the real problems that can be associated with evidence-based programs practices. So, for example, they vary in scope and sponsorship. You should realize that. Some of you already have said, you've got a state agency, state government, or a federal government, or private, or not-for-profit, or internet, all of these different agencies at different levels. And so you have this different scope and sponsorship of programs. That's a key factor to keep in mind. Criteria of what's used in each evidence-based registry varies. So, for example, I give you a concrete example of this. Some of our programs at Prevention Plus Wellness, our Sport Prevention Plus Wellness program for youth, In Shape Prevention Plus Wellness program for young adults, sometimes they're listed on an evidence-based registry as being a model program or a tier one program. Other times they're listed as promising programs. Sometimes they're not listed at all. They're not included because there wasn't enough evidence. And so it really keep in mind that one of the ugly aspects of this, if you want to call it ugly, or problems, is that this process of identifying evidence for or against a program is a human endeavor, and people differ with regard to their opinions and the processes. And so there's error in it, but then also there's just differences in assessment as well. Number three, the third ugly is that the ratings and terminology vary quite dramatically from evidence-based registry to evidence-based registry. And some of these registries will identify a simple result. In other words, programs being included or excluded as evidence-based. Other times it's multi-tiered. In other words, tier one, tier two, tier three, tier four, with tier one being the most evidence. I think multi-tiered makes more sense in terms of being realistic and reflecting evidence. But that just shows you some of the differences across these evidence-based registries. Some more ugly. Some only rate the quality of evidence and not the program. So there's program elements and components that aren't discussed. They just look at the science or the evidence, the statistics, if you will, the quality of the research, but not necessarily whether the program is even practical. Number two, and this is what I hear from you all. This is what I hear from practitioners across the country. They limit the number of programs available for you as professionals to use. And they sometimes limit your ability to adapt their use to participate to a particular setting or population. So sometimes, an evidence-based registry and will say, this is effective for juniors and seniors in high school, can't use it for freshmen and sophomore, can't use it for younger adolescents. If it's been tested in school, you really shouldn't use it in a boys and girls club or community setting. If it's a presentation, shouldn't be using it in an interactive online format. So those are the limitations. Those are the ugly aspects. And sometimes these evidence-based registries will be used to limit the creativity and flexibility and adaptability of these programs for you as providers, which I think is really an unfortunate thing. My perspective, if there's evidence supporting it, it should be adapted, and data should continue to be collected by you as practitioners along with us as scientists to continue to understand fully the contextual factors of these programs. Number three, another ugly, professionals are sometimes mandated to use only those on a registry, those programs on a registry or a list, limiting what's included or even adaptable for use. So that's what I hear from many of you. That's ugly three. Ugly two, ugly three. Lastly, some other perspectives. Errors and differences in opinion occur in the review process. I mentioned that already. These registries often do not include information necessary for fully implementing these programs. That's unfortunate. So you have the science, you have the statistics or the rating, but not how to implement them properly. 3, many lack information about external validity. In other words, the focus is so heavily on internal validity, that is it effective or not? The secondary question of who's it applicable to or generalizable to, or who can use it, or how well it can be adapted, unanswered. And so that's a real ugly aspect of evidence-based program registries, or I would say a real problem. Number 3, most often than not, these registries do not even allow or include qualitative research or case studies. And yet those are the kinds of studies that really look at real world effectiveness. So that's definitely an ugly. Number 5, concerns about timeliness of generating and updating evidence. So if you're looking at a community-based randomized trial where you're looking at hundreds of young people randomized into one group versus another, baseline data collection, follow-up data collection, and you're talking about doing that, and you're talking about having those data analyzed and then published. We're talking about months and years, and so that's a problem as well. And the opposite problem is that sometimes you'll have an evidence-based registry say, well, this is, the last study has been 20 years. We're no longer calling it valid. That also is an ugly aspect, because research is research. Effectiveness doesn't change necessarily over time. And so then lastly, program developers and providers have no participation in review decisions. These reviewers are insulated, and they are not most oftentimes, in my opinion, do they allow input from outside sources like practitioners like yourself. That's a problem as I see it. Do you see these things as problems, or do you see other bads or uglies, other limitations or problems with evidence-based programs? Let's hear from you guys right now. Share with us what you think. Do you see other problems? Yeah, go to the chat space, click on it. Let's hear from you. Let's see if I missed anything. Can be effective. Okay, let's see. I think is it Arnetta is let's see, basic audit plan. Arnetta is on a basic audit plan with 30-minute meetings to record behind it. Okay, I'm not sure what that's about. Jenna says it's often. Oops. It moved on me. You can see these yourself. I'm reading some of them, but you could maybe see them even faster than me. It's often difficult for a program, whether it's truly effective or not, to rise through the process of evidence-based unless there's more money behind it. And to build on that comment, Janice, to conduct the kinds of research that we conducted back in the day when we had NIH funding, where we spent millions of dollars, federal government spent millions of dollars to allow us to support us to conduct randomized controlled trials. That, if you look at the support and funding and challenges with conducting trials with youth on any topic is a problem, but then having the funding like you're suggesting. So we need to perhaps open up and look at other than just the tried and true perfect evidence-based research model, the controlled trial, which is the highest level of evidence from an internal validity perspective. I'm just throwing that out there for you to think about and chew on. But again, we're not making those decisions, are we? It's whoever is operating these evidence-based registries. But your practitioners, you could influence this process to maybe open up to other kinds of evidence, such as qualitative data and case studies. Cultural considerations, the price of evidence-based programs, outdated evidence-based programs. Now, I would say with Margaret, I agree with the cultural, I agree with the price. Outdated, I don't know what outdated EBPs means. If we're talking about outdated evidence, we're talking about outdated the actual wording or content of the programs. That's a possibility as well. Let's see. Christina said Christina is on a basic audit plan. I'm not sure what that is. We're going to go to Mariah says costliness to implement with large teams, training length versus turnover rates. Yes, definitely. So it's not just program materials, it's the training costs, it's the time for implementation. Very, very important comments there. Cultural aspects are flat or ignored. Good point. Statistical info may not be current or accurate, Elizabeth says. Over-reliance on quantitative data, implementation challenges, pressure to prove effectiveness, ethical, equity issues, publication, funding bias, all excellent, excellent, excellent comments. Thank you so much. We've got more to look at, so let's get through it because I've got a lot of slides here. We're running a little bit late. A couple of studies have looked at evidence-based programs. This study showed that 71% of people that use evidence-based registries found them helpful in achieving at least some objectives for them visiting the registry. But notice under number 2, less than a third, 31%, said that they implemented any new or improved evidence-based programs. Now, these researchers said continued use of registries for behavioral health care interventions is supported, but it does show the limitations when you have less than a third indicating that those that went to the registry actually implemented any improved evidence-based registry. Another study said, and this is an important point under number 1, U.S. state governments have a responsibility to regulate and license behavioral health care interventions. So it's important that, and you would expect to see that these registries mentioned in evidence-based registries mentioned in state statutes and regulations pertaining to behavioral health care, but it was low prevalence of mentioning evidence-based registries in statutes and regulations. So these researchers said that there's a need for greater awareness of scientifically based EBPRs and their advantaged needs to be fostered among state, those who write state statutes and regulations. All right, let's take a look at selected EBPRs for prevention and health. There was the National Registry of Evidence-Based Programs and Practices, NREP, was the searchable online database for those in the mental health and prevention and treatment of substance use areas. It was by SAMHSA. Many of you, I'm sure, are aware of this. It really did encourage wider adoption of evidence-based interventions, but that was phased out in 2018, and it was replaced, quote unquote, ear replacement, quotes, air quotes, with the Evidence-Based Practices Resource Center, also by SAMHSA. Here's the Evidence-Based Practices Resource Center. It's not a registry. NREP was a registry. The Practice Center is not a registry. It's a collection of scientifically based resources. And so for example, it neither accepts nor has open submissions from outside program developers, and it doesn't rate individual programs necessarily. And so that's the replacement. NREP was replaced by something that's really not a registry. That said, let's take a look at some of the things on this Evidence-Based Practices Resource Center. There's one document called Substance Misuse Prevention for Young Adults. I'm familiar with it because It has listed the sport prevention plus wellness program, that's ours, for youth ages 10 to 17. And they've listed it, even though, by the way, that this document, Substance Misuse Prevention for Young Adults, it listed sport and gave as a universal prevention intervention for youth ages 10 to 17. So this document, if you look at it, you can see under Appendix 2 on page 66, sport is listed as an evidence-based prevention program and policy, screening and brief interventions. And there's obviously other evidence-based programs and practices listed in this document, but here's one of the ones that you'll see under the heading of listed by SAMHSA under their evidence-based resource guide series. Here's another one called Preventing Marijuana Use Among Youth. It's again evidence-based resource guide series published by SAMHSA, and it lists promising marijuana use prevention programs, and it listed sport prevention plus wellness as a promising marijuana prevention program. It also listed our marijuana prevention plus wellness program as well. And for programs for elementary school, middle school, high school, both sport and our marijuana prevention plus wellness program were listed in this SAMHSA evidence-based resource guide series called Preventing Marijuana Use Among Youth. By the way, you can see the links. You'll be getting these slides. You'll be able to click on this and check this out more. Another document called Preventing Opioid Use and Overdose in School Youth was published by a division of Advancing Prevention and Treatment, ADAPT and HITA, High Intensity Drug Trafficking Area. And they have an appendix, a matrix of best available practices, and sport is listed as a potential program for preventing opioid use and overdose. And so there's another evidence-based list. Another is a list of cannabis model programs for school districts and charter school consideration. This was published just this year by the Minnesota Department of Education in June. And the marijuana prevention plus wellness program is listed as just one of 3 evidence-based programs for preventing marijuana use among youth. Another recent database, as far as I know, evidence-based program guide to substance misuse primary prevention strategies, listed by Division of Mental Health and Addictions, Indiana. Sport and InShape, both of our evidence-based programs that we provide, were listed as Tier 1 and Tier 2, respectively. That's top Tier 1 and Tier 2 programs, Sport and InShape, listed in this database. Now, as far as a searchable database, this is one of my favorite, California Evidence-Based Clearinghouse for Child Welfare, or CEBC. It is a truly searchable database, and you can use it to identify a lot of programs that for children and families. I like it because under number 2, it has an A, find the program, B, using the CEBC info guide, C, CEBC review process, so it's very transparent as to how they review their programs, and D, understanding evidence-based practices. So it's very instructional. They also include downloadable 1- and 3-page info guides, which are great for prevention and health providers. And it gives you a full description of how they go through the review process and list programs on their database. And it gives you a full a list of how to search. You can search for programs alphabetically, by list of topics, by advanced search, and there's some advanced search topic areas as well. And there's a whole program review information they provide, lots of information. So it's a great database, the CEBC, because there's lots and lots of information that's discussed here. You can see here all the way from top to bottom about the program to contact information. Our sport Prevention Plus Wellness High School and a middle school program are both listed on the CEBC as rating scientifically supported by research and promising practice. That's high school versus middle school, and good stuff. Blueprints for Healthy Youth Development. It's quite a different kind of evidence-based program, whereas CEBC, I think, has thousands of different kinds of programs listed. Blueprints is very, very limited to the number of evidence-based programs that they've list. So it's a very restrictive, and so when you're on Blueprints, there's certainly some good evidence supporting your program. And so they have three categories, three criteria, three tiers. Promising, that indicates there's at least one randomized controlled trial. Model means there's a replication, and model plus means that there's an independent controlled study. And they give you a little information about the process for demonstrating effectiveness. The interesting thing about Blueprints for Healthy Youth Development, there's only 116 programs listed, 97 of which are promising. That includes both sport and in-shape, and then only 19 are model or model plus programs. And so, by the way, this program, look at number 3 and 4, this program has concluded operation as of July of last year. It's currently dormant. It's available, but it's just not making any changes to the database. It's not adding any programs to the database. So it's currently, Blueprints is currently dormant. And like I said, both sport and in-shape are listed on the Blueprints for Healthy Youth Development. This is my favorite searchable database. It's called Results First database. It's actually a metadatabase, which I'll explain in a minute. So this was supported by the Pew Charitable Trust. Then Pew transferred the Clearinghouse database to Penn State in 2021. It's a searchable database. It's the only one that I know of that uses AI. You can actually use an AI assistant to search over 4,000 evidence-based programs in social policy areas. And the interesting thing about this database is they include programs that were found to be effective and those that weren't. And so 60% of all the LEP programs are rated as having a positive impact. In other words, 40% were found not to be have evidence of effectiveness. So they list everything. That's very interesting. And then they have different ratings. Green is the highest, yellow the second highest, red, negative outcomes, blue, mixed, gray, no effect, black, triangle, insufficient. So very detailed, and they show you how to do these. This database, Results First database, is a metadatabase. It's actually a database of 10 national databases. Again, a metadatabase. And so these are the 10 databases included in the Results First database. So if you want to skip, single databases and go to this metadatabase, which includes 10 together, searching together, from Blueprints and CEBC all the way down to number 10, Clearinghouse for Military Family Readiness. And so you can search for a program like Sport and In-Shape, and you'll see our programs being listed in different databases. So sports listed in Military Family Readiness as second rated. It's listed as in CEBC as highest rated, and so forth. So it's a great database. I highly recommend Results First database. It's a metadatabase of 10 databases. Other evidence supporting PPW programs, here's some more links. You can look at our published research. We publish real-world case studies, which I think are essential stories of real-world effectiveness by our providers, by many of our providers. Evidence-based registries and agencies. If you want to read more about PPW's evidence base, you can read it there. And theory and logic model underlying Prevention Plus Wellness programs, you can read there in number 4. So remember, Prevention Plus Wellness uses an evidence-based practices, screening and brief intervention format. So in addition to evidence-based programs like sport and In Shape and marijuana PPW, opioid PPW, so on, we are using an evidence-based practices screening and brief intervention that these organizations, SAMHSA, NIDA, NIAAA, World Health Organization, and others have identified as evidence-based practices, screening and brief intervention. Additional evidence-based prevention registries and resources. There's a great link there if you want to go to get some more resources. I provide that for you. So let's conclude today's webinar. Evidence-based program registries are online, sometimes not. Databases or lists that combine and organize information about programs that have effectiveness. Proven, quote unquote, maybe not, but evidence of their effectiveness, research evidence, depending on whatever this particular list or database identifies as the minimum or required amount of evidence to be on that database. And it obviously differs from database to database. Prevention and health providers like yourself really do need to understand the benefits, but also the limitations and the problems. In other words, the good, the bad, and the ugly associated with these evidence-based registries, program registries, to use them most wisely, to identify and then to make decisions about implementing effective interventions. We heard from some of you as to what some of these things are that you look for when you look at these and use these databases. So evidence-based program registries come and go, as you've seen. You can see what's happening. NREPs come and gone. Blueprints come, gone. Still there, but it's not being funded at the time. And if it gets funded, it'll be back. And if not, it'll disappear eventually over time, and others may show up. So to keep up to date with the range of registries and how to use them, and what's most relevant for you in your setting, with your needs and your requirements and your budget and so on, all very important. But bottom line is evidence-based program registries can help. They can definitely help if you do believe in the science of your profession, if you do believe in making database decisions, or if your state is demanding that you believe in it and that you use programs on a certain database. So some more information from you. If you want to look at more PPW program resources, there's a link. If you want to look at youth and prevention and wellness blog, great content there. Check it out. PreventionPlusWellness.com is our website, and 904-472-5022 is our home phone, our office phone. Info at Prevention Plus Wellness is where you'll find us. So I'm going to pause here, and yeah, we got 4 minutes. Awesome. So let's see if anybody has any questions or comments. Please go to your Q&A for those. Go to your Q&A. I want to have that space be dedicated for any comments. I don't see anybody listing anything in the Q&A. Now's your last chance to make a comment, raise a question. If you have used evidence-based registries, if you haven't, will you use them? Won't you? How will you use them? I'm looking at the last comment by Leslie in the chat space. Over-reliance on qualitative data, implementation challenges, pressure to prove effectiveness. You mentioned that earlier. That's a very good comment. Okay, last chance. Couple minutes left. If you want to list anything in the Q&A, I want to tell you and thank you all for joining us. God bless you for what you do for youth and families in your region. By the way, in 2 weeks, we got a brand new webinar on looking at opioid use prevention funding. So brand new, and that's really important, I think. There's a lot of funding coming down for evidence from abatement settlements. in the opioid area. Some will eventually, and is already, as you know, some of you know, trickling down for prevention. And you all need to be prepared for that. And so I've got a brand new webinar I'm putting together for that. And that's in 2 weeks, same time, same place. And I'd love to have some of you attend, because I think this is the kind of webinar, this topic of opioid prevention and funding is a topic that I think we need to learn from each other, because it's new. It's changing as we go along. So if you're not on our list to get the notices of that upcoming webinar, do go to preventionpluswellness.com, and there's a toolbar on the top, a banner, and you can drop in your name and your email so you get notified of that upcoming webinar in 2 weeks on opioid use prevention funding. Thanks, everybody. I appreciate it for you being with us and for all you do. Have a great day. Stay safe, take care, and keep up the good work. Thanks, everyone. Bye-bye.